Welcome to our new topic of discussion, of which we have with us thoracic bones. And these are the ribs and the sternum, whereby they form most of the prominence of the thoracic bones. We did also the thoracic vertebrae that forms the posterior parts of the thoracic cavity. For the ribs, 12 pairs of ribs on each side of the thorax is numbered from 1 to 12 from superior to inferior, giving a total number of 24. The number of ribs is variable. There may be 11 or 13 ribs on a side with a supernumerary rib in either the cervical or lumbar segment. The main function of ribs offer a structural support to the sides of the thoracic cavity. Remember, inside or within the thoracic cavity, we have very delicate organs, including the heart and the lungs. So the ribs do offer the protection or the structural protection to these elements of the thoracic cavity. The ribs increase in length from 1 to 7, then decrease in length from 7 to 12 rib. The first 7 pairs of ribs have direct anterior attachment to the sternum by a strip of hyaline cartilage called costal cartilage. The ribs that have costal cartilage at attach, losing my momentum at some point. Welcome to our new chapter of discussion, whereby we have with us thoracic bones. And the thoracic bones are the ribs and the sternum. And sternum forms up a major flat bone of human skeletal system, just from the point of a classification of bones. For the ribs, 12 pairs of ribs on each side of the thorax is numbered from 1 to 12, from superior to inferior, giving a total number of 24. And the number of ribs is variable. There may be 11 or 13 ribs on a side with a supernumerary rib in either the cervical or lumbar segment. Then we have the major function of rib, of which is ribs offer a structural support to the sides of the thoracic cavity. We have some elements of the thoracic cavity, which includes the heart and the major organ, which is the lung. The ribs increase in length from 1 to 7, then decrease in length from 7 to 12 rib. And we have the first 7 pairs of ribs have a direct anterior attachment to the sternum by a strip of hyaline cartilage called costal cartilage. The ribs that have costal cartilages and attach directly to the sternum are known as true or vertebrosternal ribs. Each articulates posteriorly with its corresponding thoracic vertebra. So that's the description about those true ribs, which are 7 in number, and we're told that they have a direct anterior attachment to the sternum, and as well they attach to the sternum by a cartilage known as the costal cartilage. As well, we've been told that they're called true ribs or vertebrosternal ribs. Welcome to our new chapter of discussion, whereby we have with us thoracic bones, and they're made up of ribs and sternum. As well, remember we did up with the bones of the thoracic vertebrae that forms the posterior elements of the component. Welcome to our new chapter of discussion, of which we have with us bones of the thoracic region. These are the bones which protect the elements of the thoracic cavity, and the bones which includes ribs and sternum. As well, from the posterior aspect, we have the thoracic vertebrae. Let's move directly to the description part about ribs. 12 pairs of ribs on each side of the thorax is numbered from 1 to 12 from superior to inferior, giving a total number of 24. The number of ribs is variable. There may be 11 or 13 ribs on a side with a supernumerary rib in either the cervical or lumbar segment. And the main function of rib is said, ribs offer a structural support to the sides of the thoracic cavity. The ribs increase in length from 1 to 7, then decrease in length from 7 to 12 rib. The first 7 pairs of ribs have a direct anterior attachment to the sternum by a strip of hyaline cartilage called costal cartilage. So that is where ribs attach to the sternum. The ribs that have costal cartilages and attach directly to the sternum are known as true or vertebrosternal ribs, and each articulate posteriorly with its corresponding thoracic vertebra. The remaining 5 pairs of ribs are termed as false ribs because their costal cartilages either attaching directly to the sternum or do not attach to the sternum at all. The cartilages of the 8th, 9th, and 10th pairs of ribs are interconnected medially by common cartilages to one another and then to the cartilages of the 7th pair of ribs. These false ribs are called vertebrochondral ribs. The 11th and 12th pair of ribs are false ribs designated as floating or vertebral ribs because the anterior ends do not attach to the sternum at all, and these ribs attach only posteriorly to the thoracic vertebrae. So the 12th and the 11th and the 12th pairs of ribs, they are termed as floating ribs since the anterior ends do not attach to the sternum at all, but only they attach to the posterior thoracic vertebrae. So these are the distribution of ribs, starting from this point down to this level. And as you can see, the 11th and the 12th rib, they do not attach to the sternum, of which sternum is located at the anterior region. We have the costal cartilages, which we've been able to identify or describe. So the point labeled by 5 is the first rib, then 6 is the manubrium of the sternum, 7 is the sternum, and then we have 8 is the 7th rib, and 9 is the part of a costal arc, then finally 11 or this point, 10, I should say, they are floating ribs. The rest, the vertebral bones and oscosi and the skull right there. Remember the mandible, the frontal bone, and those other bones that forms part of the human skeleton system or the exoskeleton. These are the ribs from first down to the 12th. As you can see, from first down to 7th rib, they are increasing in size. Then from 8, they are reducing in their size down to 12. So this is the articulation of rib to the thoracic vertebrae, as you can see, and you can identify some few structural features of thoracic vertebrae and as well those of rib. The part labeled 2, remember, is the vertebral canal. 9 is the spinous process, remember from our previous discussion. But let's just get our concern to the rib, which we have the part labeled 7 is the shaft or body of rib with articular facet. Then we have the part labeled 10 is the costotransverse joint, articular facet. Part labeled 5 is the tubercle of rib. Then 6 is the head of rib, and part labeled 4 is costovertebral joint, articular facet. This is the general or much description or detailed structure of rib. We have the body of rib, then costal groove, costal angle, non-articular part of tubercle, neck, head is right here, superior facet, then inferior facet dominates this point. But this is the neck of rib, and you can see the thoracic vertebrae with their structural parts. And we have head of rib at this location, which articulates directly with the body of the vertebrae, then transverse process of the vertebrae, and especially the thoracic vertebrae. We did explain that, and we'll only get to the real anatomy of ribs. The head of the rib is a projection at the posterior end of the rib that bears two articular surfaces or demifacets for contact with the bodies of successful thoracic vertebrae. The neck is a constricted portion between the head and ribs articulation with the transverse process of the thoracic vertebrae. A knob-like structure on the posterior surface where the neck joins the body is called a tubercle is located on the posterior inferior corner of each rib. The articular part of the tubercle articulates with the transverse process of thoracic vertebrae. Then the non-articular part of the tubercle attaches to a ligament which is lateral costotransverse ligament, which in turn attaches to the transverse process of a vertebra. Yeah, this is much detailed and more clear about the rib. We have the body facet or costal cartilage, costal groove, costal angle at this level, articular facet. We've been told about the tubercle, neck, head, superior facet, and then the inferior facet. These are the thoracic vertebrae. You can see the way they attach to the thoracic vertebrae, the transverse process, and then down there we have the head articulating directly with the body. Costal angle is the sharp curve in the bone lateral to the tubercle. It is marked by a prominent line on the external surface of the shaft immediately distal to the tubercle. This line marks the attachment of the deep muscle of the back. The shaft of a rib is the curved tapering segment between the tubercle and the rib's distal end. Shafts of the ribs 3 to 6 are thicker and rounded in section compared to those of ribs 7 to 12. The inner inferior surface of the rib has a costal groove that protects the intercostal blood vessels and nerve. It is most prominent on the ribs from 5 to 8. The sternal end of a rib is the anterior end of the shaft. This is rough, porous, cupped oval surface for attachment of cartilage. The cranial upper edge of most ribs is blunt, smooth, and convex. Then we have the caudal of most ribs is sharp with costal groove on the medial surface. The first rib has a broad superior inferior flattened, short, tightly curved bone with only one articular facet on its small rounded head. Its superior surface is roughened for muscular attachments. This surface also bears two shallow grooves, anterior, one for subclavian vein and the other one for the subclavian artery, and inferior trunks for the brachial plexus. The ridge between these grooves is prolonged ventrally into the saline tubercle for the attachment of anterior saline muscles. So this is the unique features about the first rib, which we told that they only have one articular facet on its small rounded head, and as well other grooves within or along its length. The second rib has a large tuberosity for attachment point of serratus anterior muscle near the external midshaft position. So these are the muscles of the body, and if by chance we'll get to know some of the few muscles which are within the body. So the 10th rib is like rib 3 through 9, but has a single articular facet on the head. Then the 11th rib has a singular articular facet on the head and lacks a tubercle. Its sternal end is narrow and often pointed. Its shaft has a slight angle and a shallow costal groove. These are the unique features within some ribs which are found along the thoracic cage. So the 12th rib is shorter than the 11th and may even be shorter than the first. It is similar to 11 in morphology and also lacks the angle in the costal groove. That's all about ribs, and I think you've been able to understand, or you've been able to have some ideas of how and the distribution of the ribs in the human skeleton system. The sternum or breastbone is a flat, narrow bone located in the center of the anterior thoracic wall that measures about 15 centimeters, which is 6 inches in length. Functions at its upper end to connect the shoulder girdle to the thorax and anchors the anterior ends of the paired ribs 1 to 7 via the cartilage. So this is the main function of the sternum. Remember, it's the flat bone, and on some instances, it may be as well called the breastbone. It consists of 3 parts. The superior part is the manubrium, the middle and the largest part is the body, which forms from the series of smaller fused segments called sternabrae, and the inferior smallest part is the xiphoid process. So this is the division of sternum, which include from the superior being manubrium, then body, the largest middle part, and finally the xiphoid process. And in some instances, it may not be seen, but let's get to check with that. So we have the suprasternal notch at this level, clavicle or clavicular notch at this point. Then we have the manubrium, the topmost part of the sternum, body which occupies the middle part, and then xiphoid process, most inferior or distal part. This is the same illustration. We have the first costal notch at this level, costal notches at the rest part. This is the lateral left part, and then we have the sternum posterior aspect. We as well have the sternal angle, which I didn't explain. So this is the sternal angle, and we'll find what's all about. So the segment of the sternum typically fused by age of 25, and the points of fusion are marked by transverse ridges. Manubrium is the most massive, thickest, and squarest of the three main sternal elements. It is the most superior element of the sternum and the widest part of this bone. Manubrium articulates with the costal cartilage of the first and the part of the second rib to form the sternocostal joints. This is the manubrium, which we've been able to identify the part of the sternum which is most thickest and the squarest, and articulates with the first one and the two ribs. Clavicular notches occupy the superior corners of the sternum. It is where the sternum articulates with the right and the left clavicle notches that articulate with the medial ends of the clavicle to form the sternoclavicular joints. For the clavicular notches are right here. Remember, we did with the description about the clavicle or the collarbones. Then we have the jugular or the suprasternal notches with the midline notch on the superior border of the manubrium. The corpus sterni is the central part of the body or blade of sternum. Then the sternal angle is the angle forward between the fused manubrium and the corpus sterni. Costal notches along either side of corpus sterni are articulation with the costal cartilage of ribs from second to seventh rib. Lines of fusion are often apparent between the sternobrai. These lines pass horizontally through right and left costal notches for ribs 3 through 5. The xiphoid process is a variable inferior tip of the clavicle. It often fuses with corpus sterni in older adults. It shares the 7th costal notch with the body.